Hi, I'm Dr. Troy Robbin Hailparn of the Cosmetic Gynecology Center of San Antonio. With over 18 years of OBGYN experience, I've changed my practice in the last decade to encompass cosmetic gynecology procedures to meet the demands and needs of my patients. Many women have bodies that aren't working for them, and when they ask their doctors, their needs are not adequately addressed. When we have children, our bodies change, but our partners don't. And childbirth issues, as well as labial issues, are the main reasons women come to consult with me. The umbrella of damage from childbirth includes bladder, bowel, and sexual function, but nobody tells us before delivery that these things will happen to our bodies. We can develop leakage of urine, called stress urinary incontinence, that occurs with increased abdominal pressure. Sneezing, laughing, bending, lifting, and this can interfere with our daily lives. Many times, women think they need surgery on their bladders, but behavioral modification like caffeine reduction, weight loss, and proper Kegel exercises can reduce the symptoms and sometimes eliminate the need for surgery. Women putting pressure on the outside between the vaginal opening and the anus to help go to the bathroom. Tampons may not stay in the way they used to. And we can have gas-like noises during sex that can affect the intimacy of the moment. Sexual function changes can include decreased sensation for one or both partners, and sometimes partners can't feel each other at all. Also, there can be fallout during the act due to the lack of support of the muscles at the vaginal opening. All of these are correctable with vaginal tightening or vaginal rejuvenation surgeries. There are 7 new vaginal rejuvenation procedures that can help support the damaged vaginal walls and vaginal opening, depending on your anatomy, your symptoms, and your desires. There is no one-fit-all procedure. Labiaplasty issues can impact on comfort, function, and appearance. When women go through puberty, genetics and hormones kick in to stimulate the breasts to grow and the labia to grow. They can become enlarged and protrude beyond the hair-covered labia majora and cause problems with hygiene, comfort, with sitting, clothing, exercise, odor, and activities of many kinds, including sexual intercourse. I have identified over 20 reasons why women come in for labia reduction surgery, and only 3 are appearance-related. There is a huge misperception that we're shaving and seeing our parts and suddenly we desire surgery, but that is not the case. Many women have been suffering since their teenage years with these issues. Women and teens may feel self-conscious or embarrassed and uncomfortable in their own bodies, and this prevents them from engaging in social activities like going to the gym, going to the beach, or attending a yoga class, or even with their intimate relationships. There are 9 labiaplasty procedures available, but 4 of them are not recommended because they cut the labia sideways and can cause scarring, as well as impact on the erectile function of the labia minora. There are 3 edge-preserving procedures and 2 edge-reducing procedures, depending on your symptoms, desires, and anatomy. Labiaplasty is a 1 to 2 hour procedure with minimal blood loss and a fast healing and recovery time. Often when there is extra labial tissue, there is extra tissue around the clitoral hood as well. There can be extra folds on the sides or extra tissue in the center. These can cause problems with access, hygiene, or aesthetics, especially if the tissue is pigmented or only on one side. The hoodoplasty or prepuce reduction procedure is a 30 to 45 minute outpatient procedure with minimal blood loss and a fast recovery time. It is often done at the same time as the labiaplasty procedure. Another labiaplasty procedure I offer is a labia majora reduction, and this is due to the extra sagging skin on the outer hair-covered lips that can often cause problems of irritation and chafing similar to that of the labia minora. Exercise, clothing, and intercourse can be painful and problematic. There are 2 labia majora reduction techniques available. One excises the extra skin only, and the other excises skin and fat. They both make the Majara more youthful in appearance, but one causes them to be more flat and the other maintains the rounded plumpness. Another requested procedure is Mons liposuction. That is the reduction of the fat pad over the pubic bone. Many women try diet and exercise but just can't seem to get rid of that extra pouch of fat. The Mons liposuction is a fast outpatient procedure with a less than 1 week recovery time. The focus of my practice is to educate you about your body, how it works, and what options you have available to address your issues related to comfort, function, and appearance. If you have questions, please write to me at info@cosmeticgyn.net or call my office for a consult at 210-615-6646. After a consultation, a review of a pelvic model and many before and after pictures, as well as a physical exam with a mirror, you will have a much better understanding as to how your body is working for you and what can be done to improve it. With this knowledge, you will be empowered to make the best decisions for you to improve the quality of your life.